And this is where external counterpulsation comes into play, and it's actually a treatment option. I mean, we talked about it quite a bit at the Canadian Cardiovascular Congress, and I mentioned that this is something that we do in our clinic, and we do this treatment, and we see amazing results. Like we've been doing it for over a decade, and so the benefits of doing this therapy is super powerful because it takes away and alleviates angina pain without the use of doing any intervention. And so this is what my whole talk is about, taking us through that journey and understanding what you can do to prevent and reverse cardiovascular disease. And so I used the conference that I just went to, like I'm changing my talk based on that, and I'm showing the data as to what happens with these people and what happens with ischemia. It's called ischemia with non-obstructive coronary arteries. It's small vessel disease. It's still an artery problem. And when we're looking at an artery problem, this is what we get into at the HeartFit Clinic. We go a lot more in depth that way.
Heartfit.ca is the website. And as we talk about ECP, external counterpulsation, we do have to remember, Diamond, that someone might be tuning in for the first time. We've talked about it several times over the last year.
Of course.
But let's go back just to remind people ECP, external counterpulsation, and how it ties in with small vessel disease.
Or large vessel disease.
Or large, yeah.
Yeah, that's the thing. And so when we look at this, I just think the small vessel disease is a easier solution for this. It used to be that external counterpulsation would be for people that were not amenable to a stent or bypass surgery. Now we're using it on anybody who has coronary artery disease. And when we look at that part of it, it's a safe, painless, non-invasive treatment to it's completely safe. And what happens is that it does require repetitive treatments to make it beneficial for people. So it's not like you go into surgery or go into see the cardiologist and they throw in a stent and a few hours later you're open and you're good. It involves a little bit of time, and so it's kind of physiotherapy for the cardiac health, which is where our expertise lies. And it involves multiple sessions to be able to come in and do this treatment. What happens during the treatment is that there are these cuffs that go around your calves, your thighs, and your buttocks. They're like blood pressure cuffs. And it sequentially inflates blood back up to the heart when the heart is in a relaxed state. So what happens is the heart contracts, the cuffs relax. The heart relaxes, the cuffs contract. And this is the counterpulsation that's happening.